So welcome everyone. My name's Anthony. I've previously worked in microbiology and I'm currently a practice educator. So I've assembled you guys just to have a chat about antimicrobial resistance and what this means to you and what this can mean for the future. So if I could get you, Ben, first to introduce yourself and your job role, please.
Hey, I'm Ben. I'm a education manager in the Learning Academy.
Excellent. And Harriet?
Hi, I'm Harriet. I'm a business support manager in the Learning Academy as well.
Excellent. So the first kind of topic is, what does antibiotic resistance mean to you? Harriet, do you want to start?
Did you say antibiotic resistant?
Yes, antibiotic resistance.
To me, it's quite a scary prospect, and it makes me think that antibiotics will run out and then we won't be able to treat serious things. I used to work in sexual health, and antibiotic resistance was mentioned there in terms of gonorrhea and things like that.
I think that's definitely one of the scarier aspects of antimicrobial resistance. If you pick up an STI or a urinary tract infection, anything like that, which can probably be quite nasty anyway, the last thing you'd want is an antimicrobial resistant strain. Antibiotic resistant strain that doesn't get treated easily. So that's definitely one of the risk factors with antimicrobial resistance, just because of the numbers of people it affects and how easily sexually transmitted bacteria transmit between people. Ben, what are your thoughts on antibiotic resistance?
Well, it's pretty scary. I guess kind of from my understanding is that not a lot of new types of antibiotics have come out. I guess what I read was the pipeline. Actually, there's not a whole lot of new generations, and we're quickly kind of reaching breaking point. I mean, people hear a lot about MRSA and stuff in hospitals, but I've read stuff in the news about tuberculosis, probably one of the scariest things potentially becoming antibiotic resistance. I think there was a strain in India that practically was resistant to everything, and I know that's been a big concern. I know they use, obviously in agriculture, they use a lot of antibiotics. So what I understood is actually some of the biggest fears should be what could come out from other environments actually, and then make its way into the human chain, I suppose.
Yeah, that's definitely a big thing. One of the last, they're called last line defenses. Some of these antibiotics, one of them is called colistin, and they tracked down resistance to this last line of defense, this antibiotic called colistin, to a Chinese pig farm, which is now obviously transmitted, kind of like, I guess, the world of COVID now. You kind of see how interconnected things are and people are, etc. And just because something happens on the other side of the world doesn't mean that it stays there. And as you said, things that happen in agriculture, the tons of antibiotics that are used for livestock, etc., does have an effect. And even in Holland, they use antifungal drugs for tulip farming. So there's some antifungal resistance coming through. It's a bit slower, but there's more that's detected. Just because of you use something more, it's more likely to become resistant. So I've got some facts for you guys, which sounded scary to me when I looked at them. So hopefully you should be a little bit shocked. So this was a report from 2015, so I'm sure the situation's probably worse now. But at the time, there were 700,000 deaths due to antimicrobial resistance. So this was a low estimate of deaths, they said. And at that time, the current cancer deaths were 8.2 million, diabetes was 1.5 million, and road traffic accidents were 1.2 million. So deaths by antimicrobial resistance are projected to be 10 million in 2050, which will cost 100 trillion US dollars,
That's really scary.
which is
Yeah.
really scary.
Yeah.
That's not comforting.
And that I don't know, I'm smiling so much. That equates to one person dying every 3 seconds, which is a lot. But in my mind, I always equate this a bit with climate change, how when things seem further away from you, you think there's loads of time to sort something out. And that's kind of the problem, I guess, when it's like a future problem and you're seeing some of the effects, but you're not necessarily seeing them in your face, all the time. You can kind of become a bit complacent towards it. So yeah, that's pretty bad.
Yeah.
Then another fact for you. So out of 40 million people who were given antibiotics for respiratory issues in the United States, 27 million of them get antibiotics unnecessarily, whilst 13 million get them as needed. So that's massive overuse. Of using
I can vouch for that. Yeah, I will tell you, as a kid, I was probably given antibiotics far more than required. I remember being a kid in the States as well. I mean, they use many prescriptions. There's overuse of all prescriptions, but certainly, yeah.
I guess if they give you the antibiotics as well, you're obviously paying for them. I mean, I'm not trying to like insinuate that they want to get money from drugs and stuff, but
I mean, that's a fine insinuation. It's probably true.
And I guess if you've got patients that want them as well and genuinely think they need them, that's a lot of pressure to withstand from the public when you're technically there to help them, and if you don't give them what they want to hear or give them what they want, and that's like your 20th or 50th patient that day, it must be quite wearing as well.
I think there's
Oh, sorry, Ben.
Oh, sorry, you go, Harriet.
I was just going to say, aside from just the fact that it means it's more likely to cause resistance, it can't be good for the people either. So, them taking antibiotics when they don't need to, what kind of sort of damage can it cause to their body?
So I guess with any drug that you take where you don't actually need it, it's going to harm you, harm part of your body in some way. And in the case of antibiotics, it's kind of harming your normal flora or the bacteria on your body that kind of live on you, that kind of protect you from bad bacteria. If they're like on your body kind of taking up space, it means bad bacteria can't attach to you and then multiply. So it's really destabilizing when you take antibiotics when you don't need to, especially if they're like broad spectrum ones that kill a lot of different types of bacteria.
Yeah.
So I thought what we could do now is go through a couple true or false statements and then just get your thoughts on them. So, antibiotics won't cause resistance if I take them correctly. True or false?
I would guess false.
Ben?
I would say false probably as well.
You're both correct. So basically antibiotic resistance is kind of natural selection. You're putting pressure on a population of bacteria to survive against all odds, and they will do their best and evolve as fast as they can to survive. So it is false. So any antibiotic use puts pressure on them to gain resistance. So you're correct. Second, so it's our bodies that become resistant to the antibiotic, so they no longer work.
False.
Yeah, false.
Yeah, so
Yes, rather than the body.
exactly. It's the bacteria within the body, not the body that can't process the drug. So third, I've never taken antibiotics, so I cannot get a resistant infection.
Oh, that's false. You definitely can, I think.
Yeah, because if it's the bacteria that's resistant, then you could get that one, which you then can't be treated for.
You guys are good. Yes. So you could be completely have no resistant bacteria in your body at all, you could take a short trip to hospital for, I don't know, a broken arm or something, or minor operation, and then you could get bacteria on you that are really resistant. So you can get them that way. You could travel to an area of the world or a city, etc., which has really high local rates of antibiotic resistant bacteria. You could eat the food, you could drink the water, and they could become part of your system for a period of time. And that may or may not cause issues depending on your health, etc.
That's scary, because
Yeah.
although I knew it when I was thinking about it, that's not something I've kind of thought of generally in day-to-day life. And I think probably people might think it's, oh, people who take antibiotics all the time are more likely, that's more likely to happen to them, but it's not at all.
And that's one of the scary things about it. And it obviously needs like a global approach because, for instance, you know, the UK potentially could be doing a very good job in terms of using antibiotics appropriately. But if you get contamination of the environment with antimicrobial resistance bacteria, it doesn't matter how well you've taken antibiotics during your lifetime. If you get these bacteria in your system, you're in the same position as everyone else. Which is kind of why it goes back to what Ben was saying about agriculture, why that's a really important point. When you're using tons of antibiotics in the agriculture, and these are the same antibiotics that are used to treat infection when you get ill, you're kind of lessening the potency of these antibiotics to help you get better. So that's really important.
I also obviously if you've traveled to countries where you can get antibiotics over the counter, I even know it's stricter here actually in the UK than it was in the US, because I remember you can buy antibiotic creams over the counter in the US, and then when I actually had a skin infection, I went looking in a UK pharmacy and they're like, no, you can't just buy that over the counter. I was like, well, actually, that's pretty reasonable. But yeah, it kind of certainly doesn't have a global approach from what I've experienced, but obviously it won't make a difference unless everybody kind of, you know, certainly in industries as huge as agriculture, it kind of makes a moot point unless everybody's on the same page.
Yeah, I was given antibiotics in Guatemala, didn't know they were antibiotics, didn't know what I was taking, and it was the ones that begin with M, the way you can't drink with them. And so
Metronidazole.
yes, and then I drank, and then I got really ill. And then I looked them up, and I was like, why did they give me antibiotics? It must have just been a misunderstanding. So yeah, that was annoying.
And this is one of the things as well that's quite important about possibly developing countries or even countries that don't have a wide variety of currently used antibiotics within stock. If they give you the best match that they can for the infection that you can, that can drive resistance as well, they need to have a good variety of antibiotics to choose from to treat certain infections in a more targeted way, which is important.
They do genetic testing now, do they? On or not? Sorry. They test the resistance of a lot of the. I know for staph, right? They do it. Obviously, I'm terrified of staph, as you can tell. But yeah, from what I understood, they do test the resistances, right? And they should give you one that obviously is not resistant.
Yeah. So that's quite a time-consuming and
expensive.
Yeah, expensive, definitely expensive test. So we do that for certain things, especially like TB, when there's a really long treatment, and you can get a lot of treatment failure if something does harbor resistance. So for some things, yes, we do that. Sometimes because something has a gene that says it will be resistant to a drug doesn't always translate that way. But it is a good indicator, obviously. So some things we will do that. But yeah, I mean, there's huge importance in terms of diagnostics and getting results as quickly as possible, as accurately as possible, to treat things as soon as possible. The sooner you start treating an infection, if it needs treatment, then the less severe it will be, and the shorter duration of antibiotics you have to give, or shorter the course, etc. So you kind of want to reduce as much as possible. Right, next, or last question I should say, is what could this mean for your family? So when you think about antibiotic resistance for yourself, obviously it kind of feels different to the way you would think about it in terms of your family. So I'll talk about this one first to give you guys some time to think. So for me, I always think about when my nephew had appendicitis and his appendix ruptured. Obviously, he had antibiotics, which meant it cleared up any bacteria going into his bloodstream. But any sort of gut surgery or anything like that would pretty much be really deadly without antibiotics. And, you know, I don't know what the mortality rate would be for that, for an exploding appendix, but appendix, not appendix. But you know, that's really scary. Things like cesarean sections, you know, bone marrow transplants, I guess, wouldn't even happen. Cancer treatment, I don't think you could even have without having access to antibiotics. The risk of infection is so high. I don't know what would happen.
Yeah.
So do you guys have any thoughts about, in terms of family, how do you think they'd cope in the time of 2050? When there's less antibiotics and you may have a urinary tract infection or some sort of infection, and there is no antibiotics to actually get.
Yeah, I do. My mom has to take long courses of antibiotics. She has a lung condition called MAI, and it's kind of an abnormal kind of bacterial infection that I guess resembles tuberculosis, and so she's on long periods of antibiotics, which is never good for you, and she has some health complications from that. So I do kind of think about them certainly sometimes. I'm actually allergic to quite a few antibiotics, so I think certainly from a personal perspective, I can't really take that many of them without breaking out in hives. So yeah, I guess if there's a limited choice in the future, I'm not going to be very well off. So yeah, I'd never really thought about but surgery certainly, I mean, any one of us could require any type of surgery that just mentioned. So I mean, it should be everybody's concern for yourself or your family.
Yeah, I think that's what's scary, that, you know, you mentioned UTIs and things. So if you just think of that as quite, you know, a mild minor thing, but actually if that can't be treated by antibiotics, it means even just small things that we take for granted can cause issues, and that's quite scary. And yeah, the surgery thing, my partner was hit by a car a few years ago, and he had surgery on his shoulder, where they put a plate in, so then had to have surgery again to take it out, and it got infected that time, and took ages to heal, and obviously he was put on antibiotics and stuff, and yeah, it's kind of bad enough even with the antibiotics.
Yeah, and if they didn't work.
Yeah, if they didn't work, I mean, well, he'd probably die. So it's kind of crazy. It affects everyone, and yeah, I feel bad now.
Definitely not good. And if you think what suddenly came to mind at the moment is sepsis, and in the trust and admission of antibiotics as soon as possible, etc. If you suspect someone has bacterial meningitis and things like that, like what would happen if you just couldn't give, you know, certain class of antibiotics, or if, as Ben said, like you're allergic and then you can't have the ones that they have. Really something to think about. Right, guys, I think we'll close there. Thank you both for attending and being such fantastic guests. So weird to say that. Yeah, thank you very much. Hope you learned something new. Or
yeah.
Did indeed. Yeah.
Cool. Thank you.
Thanks, Anne.